Yeah, my name is Heun. I'm a consultant psychiatrist, and it's my great pleasure to invite Dr. Janardan to talk about ECT, electroconvulsive therapy. Thanks.
Hi, I'm Dr. Vipul Janardan. I'm at Institute of Human Behavior and Life Sciences, New Delhi. I want to briefly talk about electroconvulsive therapy. It is a highly effective treatment for certain mental health conditions that is often misunderstood. ECT is a medical treatment that involves passing controlled electric current through the brain and intentionally trigger a brief seizure. So, brief episode of seizure. While this may sound alarming procedure, but it is a safe and performed under general anesthesia with muscle relaxant, so the patients feel no discomfort. ECT is primarily used for severe cases for depression, bipolar disease, or schizophrenia, or for getting a good therapeutic gain or for faster therapeutic gain, especially when other treatment like medication, psychotherapy haven't worked, or when rapid treatment is needed. It can be life saving in cases of severe depression like suicidal ideas, or auditory hallucination, or active, or any emergent psychiatric emergency. So or like in catatonia, it is safer in case of pregnancy also. So, though the exact mechanism of ECT is not fully well understood, but it is believed that ECT influences the brain chemical reactions, improving communication between the neurons. So, over the time, it stabilizes the mood and relieves severe symptoms of the mental illness. ECT is often portrayed negatively in many movies or drama, or it is a dramatic depiction. It is controlled medical procedure with minimal risk, and effects are typically mild, like side effects are typically mild, like temporary memory loss, like confusion, but there is usually resolved within within few weeks, or within few days. ECTs have been shown to have highly effective up to 80% of the cases, where the other conventional treatment like medication or pharmacotherapy fails to respond. So ECT is a better and safer in that way, especially in cases of the severe depression where acute suicidal ideation are there. Safety measures include like taking the consent, monitoring of the vital sign, and and evaluate thoroughly before and undergoing ECT, to have the minimal risk, or to minimize the risk. To wrap it up, ECT is a safe, effective treatment option for those with severe mental health condition. While it may seem daunting, it can offer hope and recovery when other treatment are short or fail. If someone is suffering from some disease that is not, you can ask your psychiatrist or other other mental health professional to use this treatment, to use this modality. So thank you very much.
Yeah, can I ask you, so you mentioned something like catatonia. So what is this?
So catatonia is a condition generally. Catatonia is a condition generally happens in severe depression, or like schizophrenia, or certain medical condition. So it is a complex neuropsychiatric condition characterized by stupor, mutism, posturing, or negativism, or excitement. There is a range of motor behavior and speech abnormality. uh, People with catatonia they have a state of immobility or unresponsiveness. So in this is all about catatonia.
And you said it would be better in or less risk in people with pregnancy. Why was that the case?
Yeah, because generally in other pharmacotherapy, you cannot use pharmacotherapy because of the risk to the fetus. So ECT is a safer in that way. It poses minimal risk to the pregnant woman as well as to the fetus.
Okay. And who would use this? Would it be a doctor? Do you need an anesthetist, or how would be the is the patient conscious? So can you tell a little bit about the practicability of this
Yeah,
procedure?
ECT generally, ECTs is given by the psychiatrist. The Generally we give like modified ECT these days, and with the help of anesthesia. Actually, there is a team of anesthetists and psychiatrists as well as the technician and the nurses. So they will help with the help of the team. So it is like a small procedure, or a small procedure that is like you can do it like. OPD basis, or you don't need to get admitted for the same. So before giving ECT, pre-anesthetic checkup is necessary. That is done by any anesthesiologist. So what is that? That involves the routine blood investigation as well as ECGs, and asking the taking the proper history, whether there are like certain contraindications. So these are the things that has to be taken care before undergoing this procedure. So after that, the procedure is simple: giving the general anesthesia in general anesthesia. Under the general anesthesia, procedure is done, and within the span of 5 or 10 minutes ECT is given. So it is not a longer procedure, in fact involving like or office procedure. So it is good one.
How long would it last, or is it just once in a life? Do you have it once, or do you have to repeat it?
I think 6 or 12 ECT generally given, generally depending on the condition of the patient and what condition patient is having. So 6 to 12 ECT is better, and it may be longer. Generally, it is like in the guidelines, it is said so.
Okay.